Welcome to this lecture to introduce the course for Social Work 661, Advanced Generalist Social Work Practice with Individuals Across the Lifespan. So, to begin with, the Advanced Generalist, which is you, is both a generalist and advanced. The generalist practice or integrated approach to social work was developed during the 70s when social workers we discovered that clients did not fit nicely into these categories around traditional casework, group work, and community action. Rather, social workers discovered a combination of methods was needed to address the complex problems and situations that our clients were dealing with. And at that point, there was an explosion of new therapies to treat people. Thus, the generalist approach is a toolbox, a phrase you will hear many times, either from me in this class or other people. A toolbox that is sufficiently large enough to include many approaches that we need to use with our clients, client populations, at any time, in any place. The emerging consensus suggests that the generalist perspective includes this eclectic practice base, a multi-method approach, all the while thinking about and addressing social justice. Students, you develop the students' basic knowledge, skills, and the values necessary to practice with a variety of social work populations. The generalist practice is an inclusive model. The practitioner, us, we take a broad view in our assessment, and we are prepared to intervene in many circumstances, any circumstance, and on many levels or any level. The generalist perspective is certainly and clearly useful in all social work settings and can be conducted in rural or urban areas and public-private settings. Generalist perspective in generalist areas. Whereas the generalist social worker has a breadth of understanding of social work practice, the advanced generalist social worker is developing a more in-depth understanding of how to apply the best combination of approaches to specific and diverse population. This in-depth understanding requires us to use self-awareness and self-expression very deeply and very carefully into what is called the conscious use of self. And this is something that I will refer back to undoubtedly many, many times through this class. I, as a therapist now for 18 years, am incredibly aware of this every day, maybe every hour, my conscious use of self with each of my clients. The social worker also gains a sophisticated working knowledge of major assessment and intervention strategies, which is really intervention strategy is really what this class is all about. It's opening the doors to many different possibilities. You are not going to be an expert of these different intervention strategies at the end of this class. That is not the point. And I do not want you to feel the pressure that you're supposed to do that and be that. This is opening your eyes to many different intervention techniques and strategies and models. But over time, you will use them. You may use them unconsciously. You may use them interchangeably in an hour even as you work with your clients. But this conscious use of self is a hugely important topic. As I write here, there's no element of advanced generalist social work practice more vital yet more neglected than the social worker's own conscious use of self. It is critical in preparing the worker to use himself or herself more effectively in making assessment and interventions in any practice setting. And that is because if you are extremely aware of yourself and how you experience situations, you are therefore also extremely aware of your client's self and how they are experiencing their lives and their situations, which enables you to make extremely good assessments and to apply extremely good interventions. Current evidence indicates the quality of the helping relationship itself is dependent upon the work that the helping professional does on himself or herself, which is basically on how well you understand yourself and how well you understand yourself in the clinical moment with your clients. Research supports the importance of multidimensional development in conscious use of self. Empirically based models have been generated to describe the cognitive, affective, or the emotional, physical, social, and spiritual growth processes. All 5 dimensions have been shown by evidence to be interrelated in all of us, certainly within ourselves and within our clients. We, as social workers, tend to develop first and most in the dimensions that are most dominant, comfortable, and enjoyable to us. That could be cognitive for you, that could be spiritual, that could be social. That's what that is saying. As we experience success in our dominant dimension, then we're more prepared to develop in our less comfortable dimensions. Conscious use of self enables the worker to become sensitive to clients' diversity so that interventions can be selected that match the unique need of each diverse client and system. And in other words, becoming extremely aware of yourself, of your dimensions, and how you are utilizing them in the client moment, in the clinical moment. And that helps you understand their self and their 5 dimensions, and then helps you understand best interventions, best assessment, and best interventions in an ongoing manner. That just doesn't happen just once and you're done. It's ongoing from moment to moment, session to session, time to time with your clients. Over years, if you work with them, in fact, over years. So conscious use of self, extremely important topic. Undoubtedly, I will come back to it many times throughout the class. Next topic in this introduction, long-term trends in clinical social work. Past half century, we social workers, we had few choices. Back in the day, it was psychodynamic casework. That was the dominant theory, 50, 70 years ago. But the effectiveness of that was very difficult to establish. As a result, a growing number of alternatives came about, like systemic family therapy, problem-solving casework, behavior modification. And today, there are scores of approaches used in clinical social work, scores of approaches used in clinical mental health throughout. As over the past quarter century or more, this variety of intervention has given rise to the phenomenon of eclectic practice, or basically utilizing a comprehensive, diverse, and effective toolbox. So toolbox, synonymous with eclectic practice. With so many options from which to choose, clinical social workers have been increasingly inclined to mix and match the best in various schools of thought. And what you will find is that when you're working with clients, you, like I said, mix and match probably subconsciously, interchangeably throughout the hour, or however long you are working with them. Cognitive behavioral treatment, CBT, is probably the most dominant thing that we utilize. But problem solving, psychodynamic, relational, from my perspective, I'll get into that later, all these different things we're utilizing at once. Only if you choose to specialize in something specific like anxiety and phobias, like spiders and snakes and things like that, you could be specialized in that, and if you're working in a clinic setting, maybe in Bangor or Portland, but certainly in Boston, you may spend all of your time doing that work, but that is unusual. Most of us around the country, rural and urban, use an eclectic approach, the toolbox approach. In terms of integrative practice, other efforts have been made to develop models and frameworks to integrate diverse theories and methods of practice. The integrationist movement can be thought of as a way to provide theoretical coherence to eclectic practice. And as treatment approaches proliferated over the past 30 years, practitioners began to find that they could often best serve clients by combining techniques from different schools. Early social workers also began action-oriented approaches. If you think of like a psychodynamic approach, the person sits on the couch and sits opposite from you, and you spend years looking at inner drives and things. Well, social workers were involved in the field and became involved and interested in, well, how do we solve problems? How do we take action? How do we help our clients take action? And this is especially because our clients are just dealing with average, everyday problems of living. And the psychodynamic approach just was discovered to be insufficient. A lot of folks just did not need and do not today need self-discovery, but rather help in solving problems. So action-oriented approaches, not surprising that social workers were very active in getting them off the ground and utilizing them. What do these approaches comprise? The emphasis here is on enabling clients to take action in their life situations outside the treatment session as a means of solving their problems. What can I do to help the client act more constructively in the next week is often the focal question inside the mind of the clinical social worker. And many techniques are directed towards this goal: problem solving, planning, and reviewing actions, which could be like related to job and employment, or could be related to a lot of times, relational work. So in the final slide of this lecture, research now influences most aspects of practice. Although the influence of research has increased, one must still, as in the past, stress its potential rather than its actual effect, which means you will find out, your client will tell you with words and non-words what's working and what is not working. Two issues are getting and have gotten a great deal of attention: the tie-score effect, the presumed lack of differing effects of intervention methods. It may be different for you to hear right now, but it is basically true. There's really no research, unless like for things like phobia, that there's one particular intervention that works much better than the other. They all seem to work for their particular reasons. And together, again, in the eclectic or toolbox approach. But this does encourage practitioners to use the research to find out what they should best utilize in the moment. And next week, there will be a lecture on research more directly and about all of that. So this concludes this lecture, and there will be questions for you to answer in the discussion forum around this lecture. Take care.